Today we will start the fat soluble vitamins, and in that we will start with the vitamin D. So first the basic revision about the introductory part of vitamins. So by definition, vitamin may be regarded as organic compounds that required in diet in very small quantity, but they are absolutely essential to carry out the normal biological function which are must for the normal maintenance and growth of any organism. Broadly, vitamins are classified into two categories. In water soluble, we include vitamin B complexes and vitamin C. In fat soluble category, we have four vitamins: vitamin A, vitamin D, vitamin E, and vitamin K. Out of this, for you people, vitamin A and vitamin D can be asked in the form of long question, and they are the most important vitamins. So general characteristic of fat soluble vitamins: they are soluble in fat, insoluble in water. In contrast to water soluble vitamins, they will be stored in the liver for longer duration. So they are, as they are not getting excreted, their deficiency is not that common in compared to water soluble vitamins, and manifestation also comes very late when there is absolutely low or no storage of vitamin fat soluble vitamins in the body. So we'll start our discussion with the vitamin D. Other fat soluble vitamins we will discuss later on. So vitamin D, which is also known as the anti-rickety vitamin. So apart from the usual name, all of you also should consider or remember the other name of any vitamin. Here another name of vitamin D is anti-rickety vitamin because it helpful in prevention of disease which is known as the rickets. Another name of vitamin D, it's its active form, that is the calcitriol. Also vitamin D is known as the sunshine vitamin because the activation or synthesis of vitamin D requires sunshine or UV rays of the sunshine. The plant form of vitamin D, it is present in the form of ergosterol. In animals, it is present in the form of 7-dehydrocholesterol. This plant form is also known as the vitamin D, which we usually get from the diet. And the active form or the main form of in our body is cholecalciferol, which is vitamin D3. Okay. Major circulatory form of vitamin D is 25-hydroxycholecalciferol, and active form or the main form is calcitriol, which is known as the 125-dihydroxycholecalciferol. This gets synthesized in the kidney, and the circulatory form gets synthesized in the liver. So whatever form of vitamin D we take, suppose in the form of ergocalciferol, which is there in the diet, or in the form of cholecalciferol, which is the synthesis form. So this form cholecalciferol we get from the 7-dehydrocholesterol. This 7-dehydrocholesterol is actually a derivative of cholesterol. So ultimately vitamin D is a product of cholesterol. On this 7-dehydrocholesterol, the UV rays of the sun acts, and this one gets converted to cholecalciferol in our body. So in this process, this 7-dehydrocholesterol undergoes the process of photolysis with the help of UV rays of the sun, and it gets converted to cholecalciferol, and its action or vitamin D performs its biochemical role in the form of vitamin D3, which is the calcitriol. So here initially what happens, cholecalciferol, it has, since it's a cholesterol derivative, it is hydroxylated or at the third position or third carbon. That means it has OH at the third carbon. Now then it goes to the liver, where it will, or there will be addition of OH group at the 25th carbon. So this form of vitamin D is known as the 25 hydroxycholecalciferol, and this process takes place into the liver. After that it transport to kidney, and in the kidney there will be addition of another OH group at the first carbon. Okay, so this form is known as the 1,25 dihydroxycholecalciferol, also known as the calcitriol, because it has three OH group, one at the third position, one at the 1 and one at the 25th position. So this form is the active form of calcitriol, which is responsible for the various biochemical role or actions of vitamin D. Another similar word is the calcitonin. Now calcitonin is a hormone released by thyroid gland, and it reduces the blood calcium in body. In contrast, calcitriol increases the blood calcium level. Now vitamin D also, some of the books write that it acts like an hormone. So usually any hormone acts by acting or binding with the on its corresponding receptor which are there on the target organ. As soon as hormone binds with its receptor, then there will be a process of formation of transcription, and corresponding protein will be formed from that mRNA, which regulates the any function or regulates the activity of that particular hormone. So here what happens, vitamin D will bind with its vitamin D receptors which are present on the target organs such as the bone, intestine, kidney, etc. So vitamin D binds with its corresponding receptors, and then it will carry out synthesis of certain proteins which will be responsible for the biochemical actions of vitamin D. So vitamin D acts on mainly three organs. One is in the intestine, second in the kidney, and most importantly in the bone. So all of us know that vitamin D helpful in the strengthening of the bones and the teeth. So this strengthening is possible by maintaining the calcium and phosphorus level in our body. So this calcium and phosphorus homeostasis takes place in the body with the help of vitamin D by its action on bone, intestine, and on the kidney. So let's see one by one how vitamin D acts on these various organs. So before on that, all of you also should know the daily requirement of vitamin D. So vitamin D daily requirement is 400 international units in children. In adults, it is slightly less, around 200 international units per day. In the pregnancy or during lactation, there will be extra requirement of vitamin D. Also, though older age patients who are suffering from certain bone disease, they also require extra amount of vitamin D. So either you can remember the daily requirement in the form of international units or in the form of microgram, any one. Now coming to the dietary sources, so dietary sources will include the fish liver oil, other non-vegetarian sources like egg yolk or fish, etc. Milk will contain very less quantity of vitamin D. So nowadays there are certain guidelines where milk or dairy products are fortified with a certain dose of vitamin D. So it fulfills the daily requirement of any individual, all the dairy products. Okay. Otherwise, as such, plain milk doesn't contain sufficient, or it contains very moderate quantity of vitamin D. So that is one another thing you have to remember. Apart from this, exposure to sunlight is also must for the formation of cholecalciferol, okay, to form the vitamin D3. So a question in exam will come like something like this, that write down the daily requirement, dietary resources, biochemical role and deficiency features of vitamin D. I repeat, four things can be asked together: daily requirement, that is the RDA, dietary resources, which we have already just now discussed. Third thing, biochemical role, which we will discuss. And fourth is the deficiency features, where you have to write about the specific disease which occurs due to vitamin D deficiency. Similarly, the question can be asked about the vitamin A, also about vitamin C. Same four things: RDA, dietary sources, biochemical role, deficiency features. So, coming to the biochemical role of vitamin D, as we saw in the previous few slides, that it acts on the bone, kidney, and intestine. Now we will see how it regulates the level of calcium and phosphate in our body by acting on these three organs. So, first, if we see the action of vitamin D on intestine, it increases the intestinal absorption of calcium and phosphate. How? By increasing the synthesis of calcium binding protein, that is the calbindin. So you have to remember this name, calbindin. Vitamin D will bind to its receptors, intestinal presence on the intestine. It will lead to transcription, then translation of a protein which is calbindin. This calbindin simultaneously can bind with the four calcium molecules. So more calcium will be absorbed by more formation of calbindin, and this extra amount of calcium can be come into the circulation from intestinal lumen to blood. Okay, so on effect of vitamin D on intestine, the key word here is the increasing the synthesis of calcium binding protein, that is calbindin. Coming to the action of vitamin D on the bones, here you have to remember that it acts on the osteoblast, which has the bone forming cells. So it will stimulate the calcium uptake for deposition of calcium along with the phosphorus in the form of calcium phosphate. So in normal scenario, what will happen if there is a sufficient amount of vitamin D in the blood? Then the extra amount of calcium which is there, that will be taken out into the bone along with the phosphate, and it will be stored into the bone. So there will be deposition of calcium on the bones that will lead to strengthening of the bone. In contrast, when there will be low amount of calcium in the blood, at that time this vitamin D will act on osteoclast. These osteoclasts are opposite to osteoblast. What they will do, they will take out the stored calcium which is there in the bone. From bone, they will mobilize the extra amount of calcium into the blood. Okay, so for that action, there will be requirement of another hormone, that is the PTH or parathyroid hormone. So calcitriol along with the parathyroid hormone increases the mobilization of calcium and phosphate from the bone to plasma and leads to increased calcium levels. Because as you know that the apart from strengthening of the bones and the teeth, calcium has a few other important roles, such as it causes the excitation, as well as it is one of the clotting factors, and it is also responsible for the activation of certain hormones and neurotransmitters. So whenever there will be low amount of calcium, at that time first PTH will be secreted. This PTH will stimulate the secretion or activation, causes activation of calcitriol, and calcitriol will do the mobilization of bone calcium into the serum. On the kidney, what does it do? It causes reabsorption of the calcium and phosphorus. So basically it reduces the excretion of calcium and phosphate into the urine. Okay, so this is the main three action of calcitriol on the bone. It has two-way action. In normal scenario, when blood calcium is normal, at that time the calcium will be deposited into the bone. It will strengthen the bones. Whenever there will be low amount of calcium, it will do the mobilization of the calcium from the bones to the blood. On intestine, it increases the synthesis of calcium binding protein, that is the cal binding, and that will lead to increased calcium absorption. On kidney, it decreases the excretion of calcium and phosphate. So ultimately there will be elevation of the plasma calcium. So in biochemical role of the vitamin D, you have to write the vitamin D action on bone, intestine and on the kidney. Now coming to the deficiency. Deficiency of vitamin D will lead to two diseases. In children, it is known as the rickets. In adults, it is known as the osteomalacia. So causes of vitamin D deficiency mainly, first obviously as less exposure to sunlight will lead to less formation of cholecalciferol. If there is a nutritional deficiency of calcium and phosphate, means if there is inadequate dietary intake of calcium and phosphate. 3. Malabsorption, if there is any disease related with the stomach or intestine which reduces the absorption of any food, mineral or intake, so that can be one of the cause. And finally liver and kidney disease, both are involved in the process of hydroxylation. So disease of liver and kidney reduces the process of hydroxylation, so there will be less formation of calcitriol. So these are the few causes of vitamin D deficiency. So in rickets, what happens? In rickets, there will be insufficient mineralization of bones. That means insufficient deposition of calcium and phosphate. So that's why bones will become soft and they will be easily bendable or they will be easily pliable. So growth will be markedly affected in the children and weight bearing bones will start to bend. In contrast, in adults, this disease is known as the osteomalacia. So in that what happens? The bone becomes soft and they will be more prone for the fractures. And this condition is also known as the osteoporosis. When there will be a severe complaint of particularly bones affected bone areas, particularly around the back and the knee region as well as the ankle region. So in children, you have to remember few findings of the rickets. First, obviously there will be growth retardation. Main important thing will be the boozing of the skull. So if you can see here, there is an enlargement of the skull here. So this is known as the boozing of the skull. Second, there will be protrusion of the chest area, which is known as the pigeon chest. Third, there will be bending of the bones. So bones will be kind of easily pliable and they will be certain angle formation in the bones. So it is also known as the bow legs. And fourth important feature you have to remember is that here there will be a beaded appearance around the costochondral junction. Okay, you can see here this particular line. So here this particular appearance is known as the beaded appearance, also known as the radicatic rosary. So four finding you have to remember in rickets. One is the boozing of the skull. Second, pigeon chest. Third, bow legs. And fourth, radicatic rosary. Another finding will be that there will be brittle nails. So nails will be easily broken down and that is known as the onycholysis. That is also one of the manifestation of vitamin D. So do remember these findings of rickets that you have to write if there is a question of biochemical deformities of rickets. Same question also can be asked in the viva about the biochemical deformities, or even in the spotting you can be shown this particular picture and the question will be that identify the deformity and write the deficiency vitamin. Okay, so these were the four things that can be asked in the vitamin D. The question will be like dietary sources, RDA, biochemical role, and deficiency features of vitamin D. And last thing is that hypervitaminosis, that is not much of important, but that can be seen on extra medication of vitamin D or extra exposure to vitamin D related food or something like that. So here the toxicity will be mainly due to high level of calcium levels, and the symptoms will include weakness, increased urination, increased thirst or hypertension, and weight loss, etc. etc. These are the few things which are also the finding of hypercalcemia, and the features are mainly due to increased level of vitamin, calcium and phosphate level into the blood. Okay, so one of the most important fat soluble vitamins you have to remember is vitamin D. Other important vitamin will be vitamin A that we will discuss later on. Thank you.